Right, okay, so really wonderful to be here with Andrea and Anuka. We recently went to Oslo together to represent Nursing Now Challenge at the International Forum on Quality and Safety in Healthcare, which was an event that was hosted by the British Medical Journal alongside the Institute of Health Improvement. So a really totally international opportunity for us to go and present on our views around the state of the world's nursing, but also to learn from the wonderful keynotes and the presentations that were there focusing around patient safety and quality from a global perspective. So we thought we would take this opportunity to share with you all what we took from that event, both in terms of contributing to it, but also what we learned from what we heard. And I'm going to ask Anuka and Andrea a few questions about their experiences so that we can share our learning a bit more broadly across our community. So first of all, Anuka, could you tell me when you saw this opportunity come through the Nursing Now Challenge, what made you think this is something I want to put myself forward for?
So I guess I think talking about my background a little bit would help explain this. I'm originally from Mongolia, and I trained as a nurse in Finland, and I currently work in Scotland. So I've had this kind of privilege to be working alongside very different backgrounds and healthcare systems. And I knew that every time I've moved to a new country, that my kind of worldview and horizon expanded, my thinking expanded. And I think I'm able to think more creatively and out of the box because of that. So I know that, staying in one place for a long time and working within one system, just still with time, kind of gradually, it becomes a little bit of a box, right? So in order to really expand that, I think you have to be taking on some of these opportunities to be exposed to different worldviews and different ideas, and then to also meet like-minded people. Because sometimes it can feel a little bit, if you're trying to do something different, it can feel like maybe you're a bit alone, or it can be very nice to feel supported by colleagues. So I thought that this would be an excellent opportunity to do that, to feel inspired.
Fantastic. Thanks, Anuka. And how about you, Andrea?
So my main reason to participate is so for me, or at least in Spain, when you work assistentially, like in hospitals or clinics, you have not these opportunities so easily to go abroad and go to a conference. So for me, it was such an opportunity to have the chance to go there and be in a global atmosphere, and also to be the voice of students and early career professionals, that we are actively involved and that we also can have a voice. So for me, it was the two parts. So the one that it was an opportunity for me to go to such a huge event and meeting people from everywhere, and also to speak up and be able to communicate what for us, for Anuka and for me, but also for all students and early career nurses that we are in the Nursing Now Challenge. We think about our role in the state of the world's nursing report.
Absolutely. Yeah, I couldn't agree more with both of you. I think for me, there was two areas really. I recognise that because it's a British Medical Journal event, we would probably be one of the few nurses that were actually at this particular event and having opportunity to be on the main stage to contribute to the panel around a totally nursing focused agenda item. It felt really important for us to take that opportunity and contribute to the debate. And I think there's something as well about the topic of the conference as well. So I do lots of work in my own research around supporting healthcare professionals, and particularly those that have been through adverse events and have been under regulatory scrutiny and public scrutiny as a result of that. And I think for me, it was around learning from the rest of the world about how they respond to these situations, and how they support their staff to to rebuild when they've encountered one of these types of events. So I took huge amounts of learning from the event in that space, particularly the Norwegian approach, actually, which was very much around that sense of this being traumatic for the staff as well as the family and the individuals involved, and that we treat our staff in a way that supports them to respond and recover from that trauma. So it was a real great opportunity, not just from a representation perspective, but also from a global international learning perspective as well. Mm-hmm. I took a lot from the keynote presentations, particularly. How about you guys? What about the presentations you attended, the people that you heard from?
Well, if I can start. So I was looking at the program and I wasn't exactly sure because sometimes it can be quite difficult to tell just from the titles alone exactly how well it'll align with your interests. But each and every one of the sessions that I attended was incredibly useful and an excellent learning opportunity, specifically because of the nature of the conference and the topic itself. It takes a very systemic view of the healthcare system. So it was broad enough that it didn't feel like a really niche, kind of very myopic conference that ignored everything else about the system. So the ones that resonated with me the most were about actually taking the population health approach to our healthcare system. And it really ties into this idea of the value-based healthcare. And it's one of those, value-based healthcare is one of those terms that is perhaps overused without fully understanding the meaning of it. Because I don't think until I attended the conference, I understood truly what the meaning of value-based healthcare is. And it is putting the people and the patients first and thinking about our outcomes. And I think that was my biggest takeaway from the sessions on population health, is like, how do we recenter our healthcare and change our system to actually meet the needs of our populations rather than, just going on by default, and just building new things and then trying to fix the system that we already have instead of just actually going to the root causes of what we're trying to do to achieve better outcomes.
Absolutely. Yeah, there definitely felt like there was that ability to look up and out and, as you say, systematically rather than individually focused. And I definitely got a sense of the system taking responsibility for quality of outcomes rather than saying that this sits with an individual clinician practitioner. This is about us all as a whole system, as a whole country, thinking about how we approach health and supporting the workforce to be in the best position to do that. How about you, Andrea? Any big takeaways for you from the sessions that you attended?
So I agree with Anuka because I took a lot of takeaways. I really liked the keynote sessions. I remember one of them that it was about a woman, a doctor in the Netherlands, and she explained that sometimes she needed some tests for their patients that should be done in a hospital, and she needed a proof of illegal, that these people were illegal, and it was okay, I can write a paper and say that is illegal, but it's nothing official. And it made me think about the access of the health system that is quite different in each country. And that's a topic that here in Spain is always in the media. So I think that made me think about what we have here and what in other countries is. And then also one of the most significant takeaways for me was during a session about leadership programs for different professionals at various levels, undergraduate, masters, and senior. And throughout the session, they explained different leadership programs that they were developing. And they talked about the multidisciplinary team, but they always spoke or talked about doctors. And I didn't know if I should talk, and I was so unsure about myself, but I speak up and I said, like, I suggest you that you should include like nurses in the future, because not only nurses, but we are like part of the team and a broad part of the team. And I remember one woman that came and told me like somebody needed to say it. And it was very like, it made me see that we have also a voice and that we need to say things, because if we are in the room and we don't say anything, that's not useful at all. So that for me was shocking, because I saw my impact in a session. So I would say that going there was significant for me in that aspect.
Absolutely, absolutely. And just really using that opportunity, and that will hopefully stay with all of those people in that room and that speaker to really consider how they think about, as you said, the multidisciplinary team and the various expertise that brings, because we don't want a uni-professional dominant narrative, you know, that isn't the way in which healthcare is delivered in reality. So we need to be having the right kind of dialogue, don't we? Good for you for speaking up. And that takes us to our next question, which was really about us as a group having opportunity to take the stage and lead the discussion. And we were joined by the chief nurse from Oslo, from Norway, and also the president of the health improvement. And for me, that was amazing to have that opportunity to, as we said before, take the stage and really to lead on that debate around the state of the world's nursing report and the progress towards the recommendations. And you both had opportunity to contribute to that discussion. And I just wondered what you felt you wanted to achieve by your contribution. What was really key to you? What did you hope the audience heard when you got up on that stage? Andrea, did you want to say?
Yes. So my first like message was that the future cannot made without us. So that we being there and speaking up and speaking to all those people that were there listening to us, that was incredible for me. And yeah, I think we need to be there and we need to be in the discussions, and we are an important part of the workforce. And yeah, it was great because the panel was like all the people who were in the panel were experts, and we were experts too, but in our field. So that made us feel so special. That was like my main message. Anuka.
It makes me think about what you were saying, Andrea, before we went on stage. I think we were doing a little bit of cut work, and you talked about this saying that you have in English, and I think in Spanish as well. If you're not behind the table, you're on the menu. Is that right? Yeah. Maybe not as negative as that, but yeah, because I think these discussions about the future of nursing cannot happen without student nurses and early career nurses, because we do bring such a distinct understanding and a distinct vision, and which is what the Nursing Now Challenge is all about. So I thought it was a very reasonable thing to do to bring us as advocates and to let us have a voice. And I felt like we did make quite distinct contributions, because I think we were able to showcase how our understanding of the future of healthcare and the future of nursing is different, and we are bringing different perspectives to the table. So I hope that when we went up on stage, we did bring that. We were able to show that.
Absolutely. Absolutely. I think the contribution I really took from you shared was around some solutions, because it felt like the questions and the comments we got from the audience and the response from the experts were very much around, these are the problems and these are the issues we need to address. And we were able to say to you, and what are the solutions? What do you need in terms of your professional development, in terms of your support, in order to remain in nursing and to retain that joy for the profession that you have chosen to pursue. And I think that was what was so refreshing about your contributions, that rather than restating the problems, which I think we all know really well, in the State of the World's Nursing report gives us the data to understand the size and scale of those problems. We need to be more in that solution focused space. And I think for me, that was what you guys brought to the table. And that was so refreshing to hear. So I agree with you both. It was absolutely imperative that your voice was part of that conversation.
So, and I actually see the panel really enjoying, I think, our contribution. I think so many of these conversations are dominated by people who are at a specific stage of their career, who come with a lot of experience. And I felt that they just really enjoyed having early career nurses because we bring a certain level of hope, right? Because our careers are ahead of us. And I think it's a certain level of kind of, you can call it naivete or whatever, but a hope that I think is missing perhaps from some of the discussions. So that was an excellent part of that.
Yeah, absolutely. Absolutely. And so through Nursing Now Challenge, these kinds of opportunities come up, and that we give the kind of platform for people who are part of the community to have opportunity to either present or attend these types of forums. And I wonder what you might say to people that perhaps before have been a bit nervous to put themselves forward, or have thought, this is for someone else at Nursing Now Challenge and not for me. I need to have done this, and this in order to be eligible. What would you say to them if you see they saw these opportunities come up again?
So I can start if you want. For me, one of the things that I always thought about was the language, because I'm not native in English, and for me, my advice would be like, speak up and put yourself forward, and you will see that all people help each other, and nobody will like judge you, and you are trying, you are learning, and you learn by doing. So my advice would be to do it and try it. And if you don't get it, because it's like we don't have hundreds of opportunities, so maybe you don't get it the first time, but stay trying, because what you take from these events and from these congresses is huge. So it deserves it. I mean, to do the effort.
Great. Thanks, Andrea. How about you, Anuka?
I would say something quite similar to Andrea, along the same veins, that none of it is wasted. I think sometimes it feels like we might be looking for the perfect opportunity for us that aligns exactly with our interests and our goals and objectives. Or then sometimes we feel like, oh, I'm not the best fit for this opportunity. But in reality, every experience is valuable, isn't it? And it all compounds over time. So I would say, just like Andrea was saying, just go for it, because it will all matter in the long run. And when you look back, and when I look back on the things that I've done career-wise, or even not as part of my career, but none of it was wasted. It all kind of leads to the path that you're going to be taking, and your progression, your development, even if it feels a little bit scary because you're kind of uncertain. I'd say, yeah, take that leap and you will enjoy it regardless.
I couldn't agree more. There is something, isn't there, about this is putting ourselves out of our comfort zone. It is about making ourselves vulnerable, putting ourselves forward. Will we get chosen? Then when we attend, will I be able to perform as I hope I will be able to? All of these things are quite frightening, and it takes some courage and some bravery to put ourselves forward in these situations. But I couldn't agree more. It's really about where we learn. And people talk a lot about imposter syndrome, don't they, in these kind of spaces and places. And I've started to reframe that term and think that actually, if I'm not feeling imposter syndrome, I'm probably sitting quite comfortably in my comfort zone. And that in that space, I won't be developing and I won't be growing. So a little bit of that kind of imposter syndrome is enough to make me think I probably ought to put myself forward for these things. But I've had some really positive results as an outcome of attending these types of events over the years. The very first conference that I attended, I was asked because somebody dropped out to step in and chair a session. I then ended up being a reviewer for the conference the next time round. And the year after that, I ended up on the organising committee. And several years later, I now edit the journal that is the conference that I attended that very first time. So these are the kind of spaces that you don't know where the opportunities will lead and the networks and the conversations that you might end up having. So I guess from all of us, we'd say just lean in, have a go, and there will always be the support of the other members of the Nursing Now Challenge and the team at Nursing Now Challenge as well, there to help you along the way. Any other final messages, Anuka?
Well, listening to you, Gemma, I was actually thinking about kind of a realization that I had recently. Because I applied, as you both know, I applied for the PhD fellowship, attended the interview, went well, but unfortunately I didn't get the fellowship. And this has made me reflect a little bit on, the importance of perseverance and persistence in general. And that success is, I think I'm realizing more and more, is success in whatever way you want to describe it, whatever that means for you. It's much less about perfection or even, your skills being on the high level. It is about persistence. It's about saying, this is a learning experience, and then picking yourself up and then going to the next one. Because if you try twice, it already exponentially increases your chances of getting it from the first, compared to just doing it once. So I would say also to anyone who might be listening to this is, just take as many opportunities as you can, because it does compound over time.
Absolutely. Anything from you, Andrea? Final thoughts?
I don't want to add anything else because I think that Anuka ended it perfectly. So that's the message.
I agree completely. I couldn't have said it better, Anuka. And it sounds like you're living that philosophy as well. And as you said, reframing these experiences always as a learning opportunity. I think we're always seeing it as progress then, aren't we? We're constantly moving forwards. Well, thank you both. That was so insightful. And I hope that our Nursing Now Challenge community will take some good learning from the event that we attended. I'm sure that you'd be happy to chat with anybody if they wanted to reach out to learn more. I would be as well. So thank you again and enjoy the rest of your days.
Thank you. Thank you.